Thank you so much, Congressman Jayapal, for joining us today and to talk about this. We know you've been very, very busy all last week before the holidays, so we appreciate your time.
Of course.
You and your fellow Democrats, of course, have been very outspoken against this spending bill signed by the president on Friday. What are the biggest impacts, though, for people here in Washington State?
Well, the most important thing right off the top is that we have about 2 million Washingtonians who rely on Medicaid, which here in our state is called Apple Health, but it's Medicaid. And the estimate is that about 328,000 Washingtonians will lose their health insurance because of this big bad betrayal bill. On top, and that's sort of between Medicaid cuts and cuts to the Affordable Care Act. On top of that, we have almost 1 million people that are on SNAP. This is the Supplemental Nutrition Assistance Program for people who are hungry. And the estimate here is that the average household is going to see a decrease in SNAP benefits of around $58 per household. It is a massive cut overall to the state, about $31 to $51 billion that we're going to lose in federal Medicaid funding, so about $3 billion a year, so that overall estimate is for 10 years. I think what this all means is a dramatic decrease in income, in health care. It's going to leave Washingtonians poorer and sicker. The tax cuts to the billionaires, the lowest 20% is going to see maybe a $200 increase in income, but remember that that's offset by all the cuts to SNAP and Medicaid and all of these other things. Meanwhile, the top 1% in Washington is going to see a $90,000 tax cut. And so it's breadcrumbs for the most needy and gold bars for the richest. And remember that Washington State the Healthcare Authority just released a report that shows which corporations have the most people on Medicaid. And Walmart and Amazon were 1 and 2. So that means these corporations are paying their workers not enough to get health insurance, and then they're putting those workers on health care that taxpayers are paying for. So it's a double whammy on all levels.
There is a lot happening, but kind of rewinding back to the SNAP benefits that you mentioned, also Medicaid, because I think those are the two very impactful things happening in our state. With the SNAP benefits, you can't help but think of how expensive food and groceries still are. And there are a lot of struggling families. Later on this afternoon, we understand you're going to be visiting the Northwest Harvest Soda community, the food bank there. It's just down here in Soto. And every single time we drive by it, there's a long line. Just goes to show that families are struggling.
In such a wealthy state.
Exactly.
I mean, 1 million people on SNAP benefits in such a wealthy state.
So with this new reality, how are people and families expected to tackle this and deal with this lack of funding?
I mean, I think that this is the hard part, right? Because the state is going to have to try to fill the hole, but the state doesn't have revenue unless we pass progressive revenue and start taxing folks that are the wealthiest, because we know we have a regressive tax system. But you're right about the food banks. You know, during COVID, the food bank lines, of course, spiked, but it never went down. And I was always stunned to see, because I would go and visit these food banks, and to see these lines around the block that continued. It's why I've made getting money from the federal government for food banks a priority. We just did a groundbreaking for $800,000 that I got for the Vashon Food Bank. We've gotten money for Wallingford. But this is the really terrible thing in the richest country in the world, that we have people that are hungry and poor, because these things, hunger and poverty, are not personal failures. They're failures of the government to be able to ensure that people can earn enough. You know, if you're working for Amazon, you should not be on Medicaid. You should be earning enough that you're not on health care from the state.
That is only one element of it. Going back to the Medicaid cuts, Apple Health here in Washington State, can't help but think about the rural communities.
That's right.
This is beyond the scope of Western Washington many times, and perhaps the eastern part of the state. But especially also with possible hospital closures perhaps on the horizon, what help is there for communities to continue getting their healthcare needs addressed, considering some of these Medicaid cuts?
Well, this is one of the big things we were pointing out, is that Medicaid is really helping to fund rural hospitals, also nursing homes. You know, we have a number of nursing homes and hospitals that are already in trouble. And I got so many visits from not only rural hospitals, but also urban hospitals that are deeply worried about what's going to happen to their ability to provide care. Now, there is a fund in the bill that Republicans put in at the behest of Lisa Murkowski and some others that is a rural hospital stabilization fund, but it's tiny, Christine. Sure. I mean, it's about, I think it's 50 million, and it's an acknowledgement that this bill is going to hurt people and hurt hospitals. So once again, I think whatever limited health care we already had in this country, we already know that there are so many people that are in debt, medical debt, people that can't afford their prescription drugs. This bill takes a sledgehammer to whatever is left of the medical system. And it's why I think there was just a poll out that I saw that Medicare for All has become even more popular because people think that, rightly, that in the richest country in the world, you should have health care from the day you're born to the day you die. Nobody should not be able to afford health care.
Absolutely. You know, we were just touching on this earlier. Midterm elections, not far away, about a little more than a year from now. Every single Democrat in Congress voted against this bill. However, there were a few, a couple Republican defectors in the House.
Two.
What should we expect for the midterms next year? As sort of looking ahead, and what can we do for now? Now that this bill is signed, and so how are people preparing, I guess?
I mean, I think that obviously this is going to be the big thing, is to get the word out about what's in the bill, how it's going to affect people. The way they drafted it, some of these cuts don't start until right after the midterm elections, but I think you are already seeing rural hospitals closing. I was just reading a report in Minnesota about a major hospital that has already said that they are withdrawing completely from the Medicaid program. And so I think we're going to see the effects right away, and I think this is going to be hung around the necks of every single Republican that voted for this bill, because it was not in the interest of the constituents. It is remarkably unpopular across Democrat, Independent, Republican, as long as people know about it. If they don't know about it, then obviously that's an issue. So we're going to be focusing on making sure that people understand what Republicans have done so that we can get back the House and stop this kind of disastrous action that is making Americans poorer and sicker.
Yes, thank you very much, Congressman, for giving us your thoughts. And we know that it was a very busy last week. We appreciate you taking the time to tell us more about this.
Always happy to be here. Thank you.
Thank you.